Good afternoon. My name is Kelly Marin, and today in my speech, I will be going over the benefits, disadvantages, and side effects of using fertility medications. Today, I chose this topic because infertility of women runs in my family, so it is a topic I have been interested in for many years now. I personally have seen that none of my family members have wanted to take fertility drugs. I had never really gotten into the side effects situation on why, but I did some more further research on what can happen when you do. The major things I will be speaking about today is ovarian hyperstimulation syndrome, multiple births, ectopic pregnancy, and ovarian cancer. I will also go over different benefits of fertility drugs when using them to prevent pregnancy or trying to become pregnant. So the most common fertility medications are usually classified as ovulation induction drugs. These types of medications are mostly approved for patients who have a couple different ovulation disorders and are usually trying to produce a single mature egg during a treatment at a time, meaning they're trying to get pregnant but having one child at a time. These medications may be used for what is usually referred as super ovulation with patients who have a normal ovulation function. What these medications do is stimulate the ovaries to produce more than the usual follicle that is produced per month. So what it is saying is that it increases the amount of eggs that are being exposed to sperm. Therefore, it increases the chance of someone to become pregnant. This is mostly done for women who hit their mid 30s, late 30s, early 40s. Their fertility definitely goes down as a woman ages. So with ovulation function, they need to make sure that they are producing more eggs or having more follicles to produce them. Although these seem like pretty good options for a woman, using fertility medications can carry risk. The specific risk will vary depending on patient to patient. Diagnosis of each patient would really determine what kind of side effects or risk each is prone to having. I will now be naming some of the more common risks that are seen with taking fertility medications. The first risk I will be speaking about is ovarian hyperstimulation syndrome. This side effect is said to only occur in around 1 to 5% of people who take fertility medications. According to fertilitycare.com, what this means is that women's ovaries become enlarged due to overstimulation by fertility medications. So the blood vessels supplying the ovaries become what they say is leaky, and this results in fluid collecting in the abdomen. In severe cases, hospitalization of the patient taking this drug may be required to be able to manage an enlarged ovary. This issue may last for about 1 to 2 weeks or so. The doctors have seen cases where it can last a good bit longer. That mostly happens if the patient got pregnant during this side effect when it was occurring. The second side effect I will be talking about is multiple births. Multiple births is a common side effect because what fertility medications do is cause more follicles to be stimulated in growth, as mentioned before. As stated on beingaaparent.com, women who take fertility drugs have a higher percent chance, almost a 20% higher chance, to have triplets or higher than the person who is not taking any medications. This is considered as a main risk associated with getting pregnant through the use of fertility drugs. Multiple births have a negative impact on both the mother and the baby and is tagged as a high-risk pregnancy. Mothers who are carrying more than one child at a time are more prone to complications like gestational diabetes, placental issues, miscarriages, and preeclampsia. So the next complication, side effect I will be talking about is ectopic pregnancy. This happens when the embryo plants outside of the uterus instead of the inside. Most often, it will implant inside of one of the fallopian tubes. So the ectopic pregnancy only happens in about 2% of pregnant women who are attempting to have a child. But this is definitely a higher risk when using fertility medications. Third side effect that I will be talking about is the risk of ovarian cancer. The risk of ovarian cancer can be related to women who have continued ovulation during infertility periods. With methods like birth control or pregnancy, however, the risk of ovarian cancer is decreased because of the prevention of ovulation. In recent studies, the relationship between fertility drugs and ovarian cancer have not necessarily been seen. Although there are a few risks of taking fertility medications, there's also a few benefits. Fertility drugs help stimulate hormone production and help different hormones maintain a balance related to the reproductive process and help regulate a woman's reproductive process. Fertility drugs also normalize blood sugar levels and prevent diabetes, which can also, in the long run, cause infertility. With the vitamins and minerals that fertility drugs contains, it also provides a fetus with a normal development that will help reduce the risk of miscarriages. So today what we mostly covered was the disadvantages, some benefits and side effects of taking fertility drugs. So we covered ovarian hyperstimulation syndrome, multiple births, ectopic pregnancy, and ovarian cancer, as well as some benefits like normalizing blood sugar levels and having benefits for the embryo. So overall, thank you for being here. Have a great night.